Allison Venuti, and I'm a special educator in ITL at an elementary school here in Howard County. I'd like to start by giving acknowledgement to my own school administrators who have helped the special ed team advocate for more staffing and have also jumped in to help when they can. Having said that, we are completely understaffed in special ed, and each year seems to get progressively worse. My school is relatively small, but has a total of 323 total academic IEP service hours per week. We have 11 students at our school who need CAS all day, yet our understaffed team consists of 4 teachers, 3 paras, 2 SAs, and 2 TEs. The staffing is not enough to cover the needs of our students. We're always told that in special ed, our staffing is based off of projections at the end of a school year. The problem here is that the end-of-year projections often don't match up with the actual enrollment we have at the beginning of the year, leaving us completely understaffed. Since those end-of-year projections were made, we've had 8 students either qualify for IEPs or move into our community with IEPs. We've had an additional 6 IEP referrals since the beginning of the school year. However, we haven't received any additional staffing. To address the needs of these new students, we submitted a CAS request form on the very first day of school, requesting additional staffing. To date, this request has not been granted. When enrollment goes up in general ed classrooms reach a certain size, principals can apply for another teaching position. I've seen it happen over the summer or during the school year. This same practice should also apply to special ed. Even when all 11 people on my team are at school, we're short-staffed. So on days when the student is in crisis, or if there are any people on our team out, our staffing situation worsens. Due to our limited staffing, there have been days this year when the special ed teachers at my school didn't get their lunch and/or planning. One of the reasons we're in special ed is because we're compassionate people. However, we should never be put in a situation where we have to choose between staying to help a student in need or eating lunch. In the 41 student days of the first quarter, special ed staff members had to fill out 13 employee incident injury reports. Having a special ed staff member being injured every 3 days is unacceptable. Just this week, we've had 3 more employee incident injury reports written. I truly believe that with more staffing, we could be proactive instead of simply reactive, meaning less injuries for staff and more learning for students. We felt the effects of our limited staffing more this year due to significant behaviors in students in crisis. 3 different students at my school have required up to 4 staff members to be involved in order to safely manage the students' behavior and de-escalate crisis situations. Just one of these students has eloped from the building 3 times, pinched 33 times, kicked 11 times, bit 4 times, and scratched 85 times, all in a single day. In this kind of situation, no instruction is occurring for the student in crisis or any of the other students whose coverage was pooled so the safety care trained staff members could intervene. In terms of the SA and TE staffing allocations for this year, 1 SA was allocated for 4 different students who need full day support, including the student whose behaviors I just described. 1 SA to split between 4 students simply isn't enough. When comparing our SA and TE allocations from last year to this year, 3 students we received staffing for last year were not included in the staffing allocation this year, even though the students are still at our school and the CAS request forms were submitted for each of them. While I am grateful for any additional staff that I can get from my school, SAs and TEs only work a 6-hour day and therefore are not even at school for the entire student day. Since SAs and TEs only work 6 hours during the student day, it's also challenging for the special educators to meet with these staff members for training purposes or to discuss the needs of the students. We have a TE who requested to be safety care trained, but as a TE, this individual is not entitled to the same trainings offered to HCPSS employees. We're putting the least trained staff members with our most intense students, which isn't setting anyone up for success. The bottom line is that we need more para positions in special ed. I invite you to come live a day in the life of a special educator. You could go to any school on any given day and see the staffing issues for yourself. From discussions at the monthly special ed ITL meetings I attend, I know that these challenges and concerns aren't limited to my school. I also strongly believe that the role of special ed ITL at the elementary level should be a full-time administrative position. To also have a caseload that you're responsible for is like having 2 full-time jobs. For the first quarter, my average workday was 11.75 hours per day. Even with workdays that long, I still had to use a sick day last week to catch up on paperwork and start working on my quarterly progress reports. Last year, I worked 664 hours past contract, and already it looks to be more this year at over 200 so far. This workload has had negative impacts on my health, my marriage, my well-being, and my desire to continue as a special educator. Sorry. This is my 13th year as a special educator, and it will be my last. Teaching is the only thing I've ever wanted to do, but the current system has made it impossible for me to effectively do my job. Most days I go home exhausted, heartbroken, and defeated because I cannot adequately provide for a population of children who so desperately need help. For my own well-being, I need to make the switch to general ed. In addition to my special education certification, I'm certified in early childhood education, elementary education, and middle school, so I'm hoping to stay in Howard County as a general ed teacher. Last year, I put in a transfer request to 22 schools for a general ed position, and this year I will put in the maximum number of transfers allowed. However, if a transfer to a general ed position isn't available in Howard County, I plan on applying to other counties. Sorry. In Dr. Monterano's strategic call to action, one of the desired outcomes specifically states high-quality special education services are delivered in a consistent and collaborative manner. In order to do this, the special education team must have the adequate staffing and resources it needs. We cannot continue to slash budgets and cut teaching positions and resources from schools, all while raising the bar and increasing expectations for what teachers should be accomplishing daily. Students with IEPs tend to be our most vulnerable and needy students, so more needs to be done to support them. Ultimately, the students are the ones who suffer, so we cannot let our budget restrictions prevent them from having all of the resources, staffing, and supports they need to be successful. As a school system, we have to do better. Our staff and students deserve better. Thank you for your time.